And what tools can we as clinicians or even we as human beings and as patients ourselves, what things can we do that are behavioral or clinical strategies to maybe reset the circadian rhythm to get it back on track?
Yeah, absolutely. So, first of all, I think it begins with recognition that the circadian rhythm has both intrinsic influence, the suprachiasmatic nucleus, of course, the
Hmm.
great pacemaker. There's also peripheral pacemakers, but there's also external influences, so called Zeitgebers. So, again, a lot of this is common sense. A lot of this is sort of 101, if I could say it that way, not being disrespectful. It's pretty basic, but often things that we just don't think about or don't emphasize perhaps as much. Maybe not drinking as much Coca-Cola at 10 o'clock at night, good sleep hygiene. A big one these days, Jerry, is screen time. There's some
Yep.
interesting research now to show that the more time that kids spend on their phones, the more likely they're going to be depressed. And a lot of us are saying, well, no wonder. But then it turns out that it's not so much that the sleep time is causing the depression, it's the
Right. The
screen time
screen time. Yeah.
is interrupting the sleep time. And the
Yeah.
sleep time is the critical variable here that's leading to negative mood states and cognitive problems
Uh,
and anhedonia and so on and so forth. So I think that obviously sleep hygiene comes to mind immediately. The other part about this as well, of course, is diet. And I think this is an interesting part we don't talk about, Jerry. Our metabolism is highly circadian. For example, everyone loves GLP-1 receptor agonists. I mean, everyone loves Ozempic, okay?
hmm
And everyone's talking about it. But we produce Ozempic in our body, in our brain. And here's the part that's cool. If you take glucose, say 50 grams of glucose at 8 a.m., your GLP-1 spike is much higher at 8 a.m. than it is at 8 p.m. It shows a circadian rhythm. Hence, we should probably be stacking most of our calories earlier in the day. And when you have GLP-1 systems that are released later in the day, it also crosstalks with the orexin system. It's
Hmm.
true. So when you are eating later in the day, not only are you activating GLP-1, although attenuated, you're also activating other types of proteins involved in wakefulness, which of course is contributing. So I think that's a dietary part. And then finally, I mean, getting into the whole CBT. I think all those aspects around CBT, treating underlying mental disorder if present, and if needed, clearly there's an opportunity to use agents that are approved for sleep, and they are mechanistically very different. Some are probably a little bit better tolerated than others.